March is Colorectal Cancer Awareness Month, and bringing attention to the fact that a colonoscopy can save lives through early detection. Joining me today from Florida Hospital is Dr. Alan Chudzinski. Good morning, welcome back.
Good morning. Thank you so much for having me back. I appreciate it.
You know what we love about you is how passionate you are about this, and this can be kind of an icky kind of conversation to have, right? With patients, with family members, but it is life-saving.
There's no doubt about it, and I can't encourage the viewers more than to have a discussion with your family. It's important to know if somebody's had a history of this. This is such a preventable cancer. It's the third most common cancer in the United States, and it's the second most common cause of death from cancer in the United States. And it can truly be prevented by seeing a gastroenterologist or colon and rectal surgeon and getting your colonoscopy.
So let's talk about that. What age should we be getting them? Who should be getting them? Let's get that message out first.
Age 50, everyone should be getting a colonoscopy.
Male, female?
Correct. 45 if you're African American.
Okay.
There are some other things that if you have a family member that's had colon and rectal cancer earlier, then typically we recommend 10 years earlier or prior to your mother or father, say, having had colon and rectal cancer. There are also some hereditary conditions that are important to understand, and that's why the importance of having that discussion with your family member about your family member's medical history. Furthermore, we have to realize that colonoscopy is not as challenging as it used to be historically.
You say that word and people go, I'm not going in for one of those. They don't want to do it.
There's quite a stigma attached to it, and it historically was, I think, very uncomfortable for patients. They had to come into the hospital, drink 2 gallons of a solution. Now it's much more convenient. My patients...
So it doesn't have to be that way. Check around.
Absolutely doesn't have to be that way. My patients drink 64 ounces of a sports beverage with an over-the-counter laxative that they mix and drink throughout the day. Of course, it cleans you out, but it's not painful. Most patients go home at 2 or 3 o'clock in the afternoon and start their prep and come in the next morning for their colonoscopy, which, by the way, they're completely asleep for. It's done in a supervised setting with an anesthesiologist. 80% of the time, my patients wake up and say, have we started yet? And we're all done.
Yeah. Now let's say you find something needs to be done, treatment needs to go ahead and get started. The good news is here, the treatment has come a long way just as the actual colonoscopy has, correct?
Absolutely. In fact, so much so that nowadays what I'm doing in my practice and what we're doing at Florida Hospital Tampa has to do with robotic surgery or minimally invasive surgery. So that might sound scary and it might sound like the Terminator or Transformers involved, but what the robot does is it takes out any tremor or controls fine movements that even a surgeon doesn't have. So when the patient's asleep, we make very small 8mm incisions into their abdomen. We distend their peritoneal or abdominal cavity where all of our organs stay, and we're able to put these robotic arms inside of them, and they have very finite, precise, almost 360-degree movement. I sit at a console right next to the operating room table, and I'm controlling that, and patients do really well. Patients are up the next day walking around, drinking fluids, feeling good. We can't get the pain down to a 0, but we can get it down to a 1 or a 2, and they're feeling really good historically from how they used to recover from surgery.
And again, the good news, colon cancer, this stuff is preventable, it's treatable. We have about a minute left. What's your take home? What do you really want families to know this morning?
See your primary care physician, make sure you're getting your regular treatments and follow up. Talk to them about having a colonoscopy. You have to advocate for yourself. Look for signs and symptoms.
Where can you go to get that reference? If someone, can they just go to their traditional family doctor?
Your primary care doctor should have gastroenterologists that they're aware of. You can certainly look at our Digestive Health Institute at Florida Hospital Tampa. We are colon and rectal surgeons. We are gastroenterologists. We're a myriad of surgeons that treat a variety of cancers. But symptoms and signs are so important. Weight loss, blood in the bowel movements, abdominal pain, constipation, those are all important things that we don't like to talk about necessarily with our family members, but you have to talk to your family members. You cannot let those things go unnoticed and get treated by an over-the-counter medicine. Make sure somebody's taking a look and examining the area. If you're not getting the answers you want, seek out a colon and rectal surgeon and we'll help you out.
Again, you have to be your best advocate. Thank you for being an advocate for this. Again, it's a situation, a topic that many people don't like to talk about. Thank you for being so passionate about it, and again, for saving people's lives here in our community. We appreciate it. We look forward to seeing you again, Doctor.
It's my privilege to do so, and I appreciate the time. I look forward to the future.